We will be beginning with hold 1. This hold is used to help you find the actual cranial pulse. This pulse is created as the cerebral spinal fluid is flowing through your brain and your spine. What we want to accomplish with this hold is to not only distinguish between the actual heartbeat and the cranial pulse, but to take the client to what we call the still point. And the still point is where we actually help to slow down the cerebral pulse to a point where it's barely moving. This will help to take that client to a really deep place of relaxation. The still point is the point also where the cranial pulse is going to slow down to a number less than the normal beats that it has. It usually has 8 to 12 beats per minute. Much slower than your actual heartbeat, and this is important to remember. We will close our eyes when we are working on the client and try to focus on feeling the actual pulse or rhythm. This may take some time to be able to actually distinguish, but we must master this before we can move forward into any of the other holds. First, you will need someone to practice on. Once your client is comfortable, you will need them to close their eyes and take some deep breaths with you. This will help the both of you to become more connected so that you can feel the actual subtle changes in their cranial rhythm. Once your client is on the table, you want them to scoot down towards the end of the table so that you can rest your arms on the table like this. This will be more comfortable for you while you're performing this work, because we do stay in certain positions for quite a long period of time, sometimes. You want to be relaxed and comfortable as to not let the distractions that can happen interfere with your technique. Now we're going to place a hand on both sides of the head, trying to place your fingers so that they're connected with all the cranial sutures that I pointed out earlier. We need to place our hands like this so that we can actually feel the cranial pulse. So I have a couple fingers behind the head a little bit, and then I have them spread out here so I'm hitting all of those points. My thumbs are kind of resting at the frontal lobe and the parietal lobe sutures. Now, try to relax your hands, wrists, and forearms. You do not want them to be stiff. We want to be very relaxed during this treatment so that we can allow the client to do the movements that they need to as they're releasing. You will not be applying any pressure. You will just be placing your hands and fingers where I show you. Now we wait. We are waiting to kind of feel a slight ebb and flow to the cranium. Kind of like what I showed you earlier with the pillow. It's almost like a magnetic pull, pulling your hands together, and then two polar opposites kind of pushing them away. This can be very difficult to feel at first, so do not become disappointed if you do not feel anything. Now, what you may feel initially is the actual heartbeat of the client. This will be a much faster pulse, so you will know that you're feeling their heartbeat. Remember, the cranial rhythm is only about 8 to 12 beats per minute. It will kind of help you to remember that difference between the two, if you can tell the difference between that heartbeat and the cranial pulse. A minute actually can feel like a really long time when you're just sitting here, so be aware, again, it's just 8 to 12 beats per minute. Close your eyes and allow your breathing to slow and come synchronized with the client. Do not force anything to happen. The body of the client needs to do the releasing. We will sit here for a short while in a second, and we'll allow ourselves to try and feel that rhythmic pulse. Again, you want to feel almost like a magnetic pull first, and then your hands kind of being pushed away as the cranium expands. So we're just going to sit here for a little bit and try to feel that rhythm. Close your eyes. Take some deep breaths. Have your client take some deep breaths with you. Allow yourself to relax. And you might even feel kind of a tingling sensation, and that's normal too. And try to feel the actual pull into their head, and then the actual pushing of those magnetic pulls away from each other. I'm starting to feel it. Now you will not be able to see this on the video because it is so subtle. So we really need to just kind of practice this over and over until you actually feel that pull in and the push out. Now, this should happen very slowly. Remember again, 8 to 12 beats per minute. Once you feel the pulse, I want you to just sit with your client. Allow them to become deeply relaxed. As this happens, the tension in the membranes, fascia, and muscle tissues in their body will start to relax also. This will slow their cranial pulse even more. We want to stay in the position for however long it takes, until we can actually feel the pulse slow to about 2 to 3 beats per minute. Again, this may take a long time. It could take 15 minutes, it could take 20 minutes, it could take a half hour. We need to just hang out with the client as long as we can to slow that pulse so that we can help bring them to that still point that we talked about earlier. Patience is your friend here. There is no rushing this technique. You must not try to rush the process, or your client will not benefit to their full extent. Once you have started to feel the pulse, and you are sure that you are feeling the cranial pulse and not just the heartbeat, that is when we will actually move on to the next hold. Craniosacral work is very specialized technique and should be considered a technique to be learned in a classroom setting where you can receive appropriate certification and also have someone be able to come over and kind of feel what you're feeling and make sure that you're actually feeling that contraction and expansion. You must not at any time consider this video to be a replacement for certification. Again, it is a very advanced technique, and certification is very important to be able to move forward with this work. The video will give you that basic introduction and kind of give you a feeling of what this work is all about, and then you can decide whether you want further training or not. With hands-on work, you are dealing with more than just placing your hands on someone. You are affecting them physiologically, mentally, and emotionally. Please do not take this work lightly. With that said, we're going to move on to Vault Hold 2.